In this video, we will learn about benefits and uses of Saptamrit Lauh in eye diseases including cataract and night blindness, and in premature graying of hair and several other diseases. We will also discuss the composition, dosage and side effects of Saptamrit Lauh. Saptamrit Lauh is a primary Ayurvedic medicine for eye and hair diseases. Most commonly, it is prescribed for immature cataract, conjunctivitis and vision impairment due to any underlying eye disease. In case of hair, it helps in premature whitening of hair and restores the natural hair color. In addition to these, the secondary actions are observed on blood, stomach, intestine and urinary bladder. It increases hemoglobin level, reduces gas formation in intestine, balances acid production in the stomach and improves urinary flow and reduces edema. According to Rasendra Sarsangre, Saptamrit Lauh is also called Timir Har Lauh. In Ayurveda, Timir Rog refers to the incipient stage of cataract when a person just starts having blurred vision, cloudy vision, fuzzy spots, difficulty in seeing in the dark, increased sensitivity to light as well as media screens, discomfort with bright lights and glare appearance. In such cases, this law provides maximum benefits. Especially in initial stage, internal medicines like Saptamrit Lauh and eye drops like Netra Sudarshan Ark can be beneficial. Now let's discuss the ingredients or composition of Saptamrit Lauh. Saptamrit Lauh contains Yashti Madhu, Amla, Vibhitak, Haritki as well as Lauh Bhasm in equal quantity. Note: Saptamrit Lauh is incomplete with these 5 ingredients. There are 2 essential ingredients which should be mixed just before taking it. These ingredients include ghee as well as honey. 1 gram mixture of above 5 medicines should be mixed with 3 grams of ghee and 6 grams of honey. This is the correct method for taking this medicine. Taking just tablets without ghee and honey may not give results as described in this video. All these 7 ingredients are essential in the same ratio as given above and exert a synergetic effect. Some people mix Trifla Churn, Yashti Madhu Churn and Lauh Bhasm in equal proportion. This formulation is misinterpreted. If you take this formulation, it increases the quantity of Lauh Bhasm in it, which is not right for using it for a longer duration. In classical texts, its regular use is recommended for 1 year, which is not possible with this type of formulation. Secondly, the dosage of Lauh Bhasm exceeds from its recommended dosage in such formulation because 1 gram is an accurate dosage for Saptamrit Lauh. Medicinal properties. The medicinal uses of Saptamrit Lauh are attributed to the following medicinal properties. Chakshusya improves vision, antacid balances stomach acid, carminative relieves gas, antiemetic alleviates nausea and vomiting, detoxifier detoxifies blood and prevent or treat skin diseases, antipruritic alleviates itching, antioxidant. All herbs present in this medicine act as an antioxidant. Demulcent, soothing and softening effect on the skin. It promotes hair growth, restores natural hair color, and also works as aphrodisiac. Saptamrit Lauh indications. According to Bheshajya Ratnavali, it is indicated in the following health conditions: immature cataract, night blindness, burning sensation in eyes or skin, vision loss, blood disorders, small pimples or small red bumps. This condition is likely to be rosacea or similar condition, pruritus or itching, tumor, pain in which a person feels pins and needles are poking in the skin, which generally occurs in neuropathic pain, chronic loss of appetite, and premature whitening of hair. In addition, it promotes longevity and improves mental as well as physical stamina and endurance. So, it can also be used by sports people and people suffering from impotence. However, a person may also require other remedies along with it, especially in the case of impotence. Chakradath had described some additional indications as follows. Parinamshul, stomachache occurring due to digestion of food. Amlapit, acid peptic disorder. Ana, abdominal fullness or distension. Mutraghat, urinary obstruction. Furthermore, it may also help in the following cases: nearsightedness, farsightedness, age-related macular degeneration, diabetic retinopathy, glaucoma, optic neuritis, computer vision syndrome. Primary indication of Saptamrit Lauh is vision loss, which is a broad term. It includes several eye disorders. In our opinion, it can be used in all disorders in which a person suffers from vision loss or low vision. It can be age-related and disease-related except by birth blindness. Let's discuss Saptamrit Lauh benefits and uses in more detail for some important indications. Immature cataract. In immature cataract, patient experiences a cloudy, dim or blurred vision and feels difficulty during night time. He may also have increased sensitivity to light and may not tolerate glare. In this initial stage of cataract, Saptamrit Lauh along with Trifladi Grit or Itrifal Kishnizi and Netrasudarshan Arc is found very effective. It may reverse the changes in lens and restore the natural vision. It may also help to slow down the progress of cataract in later stages. Vision loss. Vision loss is a broad term and it can have several causes. Some of them include cataract, diabetic retinopathy, glaucoma, macular degeneration, age-related vision loss, optic nerve inflammation. In such cases, Saptamrit Lauh along with Trifladi Grit or Irtifal Kishnizi and Netrasudarshan Arc is very beneficial. It improves eyesight and prevents further loss in vision. Night blindness or nyctalopia. There are several eye conditions that can cause night blindness. These include cataract, retinitis pigmentosa, nearsightedness, etc. In all these conditions, Saptamrit Lauh is an effective medicine when used in combination with Netrasudarshan Arc. Note: night blindness is also caused by vitamin A deficiency, so patients should require treatment accordingly. Computer vision syndrome. Nowadays, everyone uses computer. In some people, the continuous use of computer leads to dry eyes, eye fatigue, eye strain, headache, blurred vision and increased sensitivity to sunlight and even monitor screens. Increased sensitivity causes watering in eyes. In such condition, Saptamrit Lauh along with Netrasudarshan Arc provides maximum benefits. In addition, this combination also prevents future eye problems due to computer use. Premature graying of hair. In classical text, Saptamrit Lauh is praised for its effects on preventing and reversing premature graying of hair. Most people believe that we cannot restore the color of white or grey hair, but it is not true. If you suffer from early graying of hair, then natural hair color can also be restored. However, treatment might not be effective in old age. For this purpose, Saptamrit Lauh provides excellent results. This medicine can be used along with Bhringra Churn and local application of Jatamansi oil. In this combination, treatment should be continued for 6 to 12 months. In our experience, every patient gets good results with this treatment for reversing premature graying of hair. Saptamrit Lauh dosage. The standard adult dosage of Saptamrit Lauh is 1000 mg along with 3 grams ghee and 6 grams honey. The maximum dosage of Saptamrit Lauh should not exceed from 2000 mg or 2 grams per day. It might not be suitable for infants that are below 12 months. However, in case of children, it should be given 15 mg per kg body weight. And for adults, the recommended dosage is 1 gram. How to take the medicine? Saptamrit Lauh should be taken once or twice a day. Medication timings of Saptamrit Lauh. If Saptamrit Lauh is recommended once a day, then the best time to take it is in the evening. However, if it should be taken twice a day, then morning dose should be taken 30 minutes before breakfast or 1 hour after breakfast. adjuvants. 1 gram Saptamrit Lauh is required to be taken along with 3 grams ghee and 6 gram honey for the best results in the health conditions indicated in this video. However, after taking this medicine, one should also drink lukewarm cow's milk. Side effects of Saptamrit Lauh. This medicine is likely safe and well tolerated in most people when used under professional supervision. Thank you for watching this video. If you like this video, please give us thumbs up and share this video and subscribe our channel Ayur Times.